Exercise is my favorite topic. Physical activity, everything related to being active with diabetes, any type of diabetes. To be honest, it's important for everyone, but particularly important if you have prediabetes or diabetes and you want to effectively control it. In fact, being more physically active is probably the most critical part of lifestyle management, along with a healthier diet. And the reason for that is that we have several ways to deal with carbohydrates when we eat them in our diet. And in order to keep the blood glucose level normal, we have to be able to store extra carbohydrates that we eat. And insulin at rest helps us take up carbohydrate and put it into muscle and other places, to get it out of the bloodstream. But exercise itself, the muscle contractions, are a completely independent but additive mechanism to take up blood glucose. So it's kind of like you have a way to erase your blood glucose mistakes by being physically active. I think the hardest thing is that there are many barriers to being active. It may be that people see themselves as having physical limitations to doing it, or they're currently sedentary, they just don't know where to start or what would be appropriate, or they go to a personal trainer that has them doing burpees and they don't go back again. So what we really need to do is think of ways to integrate more physical activity into our daily lives and not just think about exercise being the structured, planned things that we do. So it's as simple as maybe standing more during the day, having a standing desk, or simply breaking up your sedentary time, getting up every 30 minutes and walking around for a little bit, doing some stretching. You should have active meetings, where people are walking around. It's amazing how much better your brain works when you're physically active. I think it's an evolutionary thing. You have to be able to think on your feet and run away from the predators trying to get you. And you store all that in your brain, and you really work really well when you're physically active. If people would just focus more on moving, I think that's where we're going to be able to do this societally, because otherwise it's just not going to happen. People are going to find excuses to not go and do 30 minutes of planned activity. They'll say they don't have the facility, or it's just not convenient, or they don't have the time, or there's XYZ. You insert your reason here why you're not doing it. It goes way beyond the individual. Right now we have so many things in our built environment that keep us from being physically active. For example, we have to go to an office, we have to work at a desk, we have to sit there. Why can't we get up? Well, because everything we do is kind of tied to technology, a computer, a phone, or whatever. So, even if you're at your desk, maybe there's a way to stand up while you're talking on the phone or during a conference call rather than sitting. And it's just going to take things like that where people bring awareness to that, and maybe the employees and the employers are both aware of it, and the employers are fine with people standing up during meetings instead of always making them sit. I mean, we have to actually start at the level of school, and kids, we make them sit for extended periods of time and expect them to learn well. It just doesn't happen. Taking the escalator, even here at the American Diabetes Association meeting, I have seen so many people just standing on the escalator, when in fact if people would just walk up and down the escalator, they would get so much more activity during the meeting, and they just don't even think about that. So I'm like, pardon me, excuse me, I'm like trying to walk up the escalator. In fact, they have done studies on this. The most common reasons why people drop out of exercise programs in the first 6 months are that they start at an exercise intensity that's too difficult. They don't enjoy what they're doing, which can tie back to the exercise intensity, and they get injured. And particularly in people with prediabetes, diabetes, they're more prone to overuse injuries, but particularly if any time when blood glucose goes up, it can stick to collagen. It doesn't really stick, but become part of the collagen and change the structure of the joints and make them more prone to irritation and inflammation, and basically what we call our overuse injuries, itises. It's really critical that we start out slowly, especially if we've been sedentary, and that we progress slowly and kind of look at it as a lifetime thing that you're doing, a lifestyle. It's something you want to be able to do for the rest of your life. So running, jogging may not be for everybody, and I actually would not tell most people to have that as their end goal. walking more, standing more, doing some kind of resistance training, even if it's using your own body weight as resistance, is really critical to aging well. Balance training when you're over 50, all of these are really important to just maintaining an independent and active lifestyle with or without diabetes.